with this.
There's a question here.
Normally, you can give it in hot water. Of course, it is the taste, amlaki powder taste at the beginning. You will have that kashaya rasa, but later on, it have very nice taste.
Elma, you got a question back there? Maybe you can speak up loud so everybody.
Oh, no. Surely, I'll be prescribing many. I mean, I'll be advising many other things. That will be there. But as a quick prescription, but majorly, I'll be advising to the parents, not to the child, because they are the real issue. For example, I usually oftenly go to schools as a child doctor to speak with the students in the schools and teachers. So in India, many times what happens that in most of the schools, they will eat a lot of chocolate. And every day, one or the other day, they will have birthday and they will bring chocolate. It is, once it happens, one day it is fine. But not every day. In the bus, they share the chocolate. In the classroom, they share the chocolate. It makes a lot of utklesha, according to Ayurveda, makes this type of problem. So when I give lessons there in the school, I tell the teacher, tell the students not to bring the chocolate. If they are bringing, you collect it and give it some Independence Day or some other day.
And that really fascinates me because it's a very simple prescription, and it's so endemic also in Europe, and I assume also in the United States, and that would be a very easy regimen to prescribe. And I would also expect a large degree of compliance. It's so difficult to motivate children to take medicine, and I assume churna in low dosage is not a very big problem.
No.
Do you see a lot of compliance problems among?
No. There is no problem because I prefer more churna than tablet because I like the children to experience the taste of the medicine. Because basically nowadays what is happening that in Ayurveda we are converting the formulation that will not allow the tongue to enjoy. I personally believe that Ayurvedic formula should have to undergo through the mouth in a proper way, not to bypass things, so that let them experience the different taste because that have another influence in the system, at least for the child.
Well, great. That actually brings us to a topic that I was going to ask you people later, but might ask it now. So here in the West, we often experience that a lot of drugs, Ayurvedic drugs, herbs are not available, and in particular also many times difficult procedures that you might prescribe at the university maybe, or even in Switzerland if you have inpatient capacity, are not easy available, first of all. And moreover, a lot of the therapeutic elements are also maybe odd or alien to patients, in particular when it comes to practices like Shiro Virechana, with the application of smelly oils, etc., etc. So, what do you think about just applying, principles of ahara, vihara, and maybe simple herbal formulations like the one you have just mentioned, even in more serious health conditions? Manjusha, you might want to answer that one.
See, like amlaki he told, and to her, if some child is not able to take amlaki because of the taste, I think you can mix with honey. Honey is very much palatable to the children and they will easily lick. And coming to that, we are using turmeric. For my daughter, touchwood, we have never given her antibiotics. Only once we gave her, and that was a failure. After fever, she developed delirium, and then we had to go to a pediatrician. And he was not able to diagnose the condition, and he gave 3 groups of antibiotics, and again we switched on to Ayurvedic treatment. But for my daughter, single dose of milk with turmeric. So we advise that take turmeric, pinch of turmeric that roasted in ghee and put in milk. That is, particularly we prefer cow's milk, and daily you drink, preferably at night.
For which condition?
For allergic rhinitis.
Same condition.
Yeah,
different prescription.
Yeah, this one, okay. And turmeric is available in every household. For cooking purpose we are using, but we ask the mother to fry in ghee and keep it separate. So home grounded this turmeric will be very good, because otherwise there may be some color additives which may be more harmful than its benefits.
And what about I might just want to ask you about the milk controversy and allergic dispositions and atopic conditions. You don't see a problem in that?
See, it is a concept of Agni. Why allergy develops? When our Agni is not able to digest a particular substance. You see, every patient of rhinitis, every patient of ear discharge, every patient of bronchitis will have the coated tongue. And they are not bothered. I'll tell you an experience of fungal sinusitis. He had undergone antifungal treatment. And when he came to us, he was a 15-20 years boy doing some business. And when I saw his tongue, it was thickly coated. So what I gave, only shunthi water. Shunthi water,
ginger water.
Change water and his lifestyle. Because young boy doing business from affluent family, so he is taking samosas and pizzas, cold drinks very oftenly. His name was Vikas. I told you have to follow me and then only I'll treat you. You won't believe it took more than 2 months to remove that coated tongue or to remove that coatedness, and then his fungal sinusitis was normal. We repeated CT scan. It was showing only mucosal thickening, no fungal sinusitis was there. But when he came to us, he was having still all the symptoms of sinusitis. And till date, now his whole family is coming to us. And this is one example. The Pachana or Agni is very much important. And if you feel child's Agni is not there, you take half cup of milk, put same amount of water, boil it, dilute it and give it. It will be easily digested.
I really love your examples because it really shows that it does not always need a complicated procedure to achieve good effects. And I don't know, you might have a different experience, but I have the experience that a lot of patients also come to our outpatient departments, in particular in Western countries, not because they want yet another very complicated and technical procedure, but because they want to go ahead with measures of self-effectiveness and self-healing. So I really like these, these simple tricks that can do a great job.
Can I add something, especially when she told about turmeric? Whenever we get patients with severe secretions, what we do very quickly is that we take a cloth, we put turmeric powder, we roll and put it in the ghee, or we can use directly also. You burn, you inhale the smoke. Just like, it is like almost like dhuma nasyam. It's like a smoke nasya. Immediately very effective. I have so many students, they have already experienced that. It is costly, no, not at all costly, very easy, turmeric and a cloth, that's all. It will immediately stop. It is little bit ruksha in nature, so if a person like very pitta type of person, so they may have real irritation, so the amount of smoke has to be controlled properly. Otherwise, it works very easily.
Great. Well, maybe going back to Johan, suppose you have a patient who does not have any money to do a series of tarpana, or who does not want to come to your OPD regularly in case of a dry eye condition. Is there anything from the Ahara Vihara section that you would advise them that you think could do a good job, other than tarpana, netra tarpana?
Nasa tarpana. I tell them every morning when they do the dental hygiene, and every evening they should put 2 or 3 drops of oil on the finger and massage the inside of the nose, and then take it in the sinuses. And this is something that everybody can do very easily. It just needs a little oil bottle next to your toothbrush, and in that way they can quickly get rid of these complaints. It can be even a sesame oil will work wonderful, and of course if you have a specific indication, we have to have a medicated oil with a soothing or with the drugs mixed with it.
I was very amazed that recently I went to a discounter in Germany, Rossmann, for those of you who are German, you know, just a regular discounter. And there you can buy dispensers for sesame oil for €2.80 or something like that. I don't know if you have noticed that, but sometimes, you know, things are already available in the market. And next time you're going to Rossmann or DM, you might just want to check what they have to offer, and some of these things are really useful for your daily practice with Ayurveda, I must say.
But I have maybe in my observation, when we use sesame oil in the nose, in some of the patients, it has an influence in the menstrual cycle. It is making some alteration in the menstrual cycle.
Like what?
There is irregular menstrual, it is changing the menstrual cycle. So there's a randomized observation. So maybe I normally don't use plain sesame oil. I use some medicated oil for doing this.
So it's a black sesame? I don't think it's available here though on the market.
And another thing is, even if you are using for what he told, that 2 drops putting into the nose, that we call it as Pratimashnasya. So I don't think that Pratimashnasya will cause menstrual abnormality. The best thing to prevent, even if it happens, like we say, the murchana of the taila, raw oil is not to be used. What you have to do, take whatever 10 ml or 20 ml, just boil it. When the smoke starts coming, cool it, put in water, so that, because for Nasya, Karnapurana and all, that Kharapaki Tela is to be used. So I think then it will not cause such problem. And then you can see the difference, or all others also you people can try, I think. We are using plain sesame oil for Pratimashnasya, Anu Tela, which is very easily available in ROPD, or Ghrita, as he told, for dry eye. Simple cow's ghrita you can put, and no applicator is needed. Anguli, finger is the best applicator, is the best shastra. Take separate 2 fingers if you don't want to have the the same this thing. So put in one with one nostril, one finger, other nostril, another finger. So you have that way. Or you ask somebody, plastic droppers are coming with the nasal drops. So ask the patient to lie down, and some attendant mother or somebody, they can put, and 2 drops, nothing happens.
No, Manjusha, I was always wondering, you just mentioned Pratimashanasya with Gritam also, but why is actually Tiltel, so sesame oil, the first choice for Pratimashanasya? Why not go for, you know, Pratimashanasya with ghee as a general of thumb? Is there any explanation for that?
Yes. Yeah. Pratishaya definition is Vatam Pratishayam Abhimukham Vadadinam Dosham. Like all the other 3 doshas, they move along with Vata. So in Pratishaya Samprapti, Vata is the main factor. And for Vata pacifying, the Tiltaila is best. That is the reason that Tiltaila is best for Nasya. Ghrita we give if the Pitta is aggravated or Rakta is aggravated. And even you can use fresh juices. Suppose some bleeding is there, we use juice of that common grass. And simple, just make the juice of that garden grass.
So we could just go outside and pick up some grass and make it.
And make a juice and put it, immediately that bleeding will stop. That is a simple thing. Very good antiseptic action. Because Durvadi Ghrita is one yoga that is told in Rakta Pitta. But if nothing is available and suddenly mother is alone with the child, pick grass from the garden and take juice, clean it, make juice in the mixie and put few drops, bleeding will stop.
Interesting. So,
Durvaswaras.
I was talking earlier, discussing with Professor Anna Dhruva from San Francisco, you know, what comes to your mind in terms of interesting topics for this round, and you really made a very good point that in conventional ENT there is a number of conditions that are sort of considered to be almost incurable, like a certain, certain diseases of the eyes or of the ear, like cataract or otosclerosis, or massive forms of tinnitus, etc., etc., that in conventional approaches, you would say, we're basically following a more palliative approach. So do you have the feeling, maybe Dr. Nambi, you can answer that in some of these heavy conditions where in conventional medicine we would say, okay, we can help you to relieve your symptoms, but there's nothing, causative to do. Would you say Ayurveda can offer, causative treatment?
Definitely. Very recently I had such experience. A patient is come with a tinnitus. She had a very frequently that type of sound coming from the ear, and I started giving some medicine, and she felt a symptomatic relief, then again come back. Then I thought maybe she has something SOL, space occupying lesion, and on detailed investigations I found that she has a schwannoma, Schwann-Zell's malignancy inside the thing and creating this problem. So definitely she has to undergo a surgery. But she told, I feel your medicine comfortable. So can I have your medicine until I have surgery? I told, fine. Then I prescribed the medicines, and she's still continuing the same medicine. Her tinnitus feeling is really very, very less. I don't know how that irritation that created by the parietal side of this intraocular area where the schwannoma is creating the pressure is, but she feels very, very comfortable. I use a formula called Varanadi Kashayam. It is very popular formula, is available in Kerala, and she was taking that decoction every day twice.
Which is of course not available over here. So what would you do with her over here?
Here, I don't know, but
it's available here? Yeah, where is it? At your place? Okay. What is the name of the kasha? Varunadi?
Oh,
yeah, that is actually available.
Yeah, sure.
See, if you don't have Varunadi Kashaya complete, you can have only 2 drugs, Varun and Shigru. That we are doing some trials in our practice. When Varunadi Kashaya is out of stock in our OPD, we take single drugs, Varun and Shigru, for these conditions. And 2 drugs only, and the inflammation or the secretory part comes down.